thought what we'd focus on today are all the promises that have been made and broken with respect to the health care reform bill that's on the floor of the United States Senate, things that the President has said, things that congressional Democrats said that they want to accomplish. And in the great tradition of our physician here, Tom Coburn, I thought we have a little RX of broken promises. But I want to start with the promise that no tax increases would occur for the middle class. You all know during the course of the campaign, and as recently as August in Florida, President Obama said that he wouldn't raise taxes, he wouldn't raise income taxes, he wouldn't raise payroll taxes, he wouldn't raise capital gains taxes, he wouldn't raise taxes of any kind on people making less than $250,000 a year. Well, we all know the Joint Tax Committee has just said now that of the people who make less than $200,000 a year, 39% would see a tax increase, and if you allow for premium subsidies, you still have 24% of those making less than $200,000 a year who would see a tax increase, which applies to 39.9 million Americans. So the no tax increase for the middle class, I think you can say, is a promise made and a promise broken. It also said that it would lower health care costs. And of course that's a promise that was made throughout the course of the campaign. It's been a recurring theme among the President and his administration, the Democrats. It's going to lower health care costs. We also know that according to the Congressional Budget Office, that for most Americans, you're going to see at best your premium increases go up like they have been at twice the rate of inflation up to the foreseeable future, and the number that the CBO used and we've been using is 2016. So if you think of 90% of Americans are going to see their insurance premiums either stay the same at best or at worst go up. If you're in the individual marketplace, according to the CBO, your insurance premiums are going to go up 10 to 13%. If you buy in the small group market or in the large group market, you're going to see your premiums continue to go up at about a little under 6% up to 2016, so much so that if you're a family of four and you're getting your insurance right now in the large group market and you're paying paying $13,900 a year for your health insurance today, under this plan in the year 2016, which again is the baseline year that's used, you're going to be paying over $20,000 a year. So lower health care costs, I don't think so. Again, another promise made, another promise broken. The bending the cost curve down. We also know that CBO has come out and said that overall health care costs would increase by $160 billion under this plan. So this notion that somehow, and of course the promise was made that it was going to bend the cost curve down, just isn't true. Health care costs, overall health care costs, according to the CBO, are going to go up by $160 billion. So again, another promise made and another promise broken. Keep existing insurance. In the debate last week, we actually talked about this issue of what was going to happen to people who are on Medicare Advantage. There are 11 million Americans who receive Medicare Advantage, and obviously if you cut $118 billion out of Medicare Advantage, that's going to impact the benefits for an awful lot of Americans, at least 11 million Americans. And there are lots of other Americans, and I think Senator Coburn will get into this, who are not going to be able to keep what they have. This whole idea that you'll be able to keep what you have completely got shredded last week in the debate over the Medicare cuts. And I might add, so much so that even Senator Casey from Pennsylvania went so far as to say that on Medicare Advantage cuts, we're not going to be able to say if you like what you have, you can keep it. And that basic commitment that a lot of us around here have made will be called into question. So you even have Democrats now saying that this notion that somehow you can keep what you have is going to be sustained in this bill. It's not. So another promise made, another promise broken. Now, the no cuts to Medicare. Who are we kidding? They talk about this isn't going to impact Medicare. You're talking about $465 billion in the first 10 years when it's fully implemented. In the first 10-year period when it's fully implemented, about $1 trillion in Medicare cuts, and we all know where they come from. I just mentioned $118 billion out of Medicare Advantage, $135 billion out of hospitals, $15 billion out of nursing homes, $42 billion out of home health agencies, and we had the debate about the Johans Amendment yesterday, and even about $8 billion out of hospice care. So Medicare is going to experience big cuts under this proposal, and that again is something that the President in his State of the Union speech earlier this year talked about on the campaign trail, that there weren't going to be any Medicare cuts. So another promise made, and another promise broken. The open and transparent process, this was all going to be on C-SPAN. You know, the promise that was made when we do health care reform, we're going to let the American public in. All these meetings are going to be televised on C-SPAN. Again, this was written with 3 people. It was basically Senator Dodd, Senator Baucus, Senator Reid, and members of the administration behind closed doors. Nobody had access to that. None of us, none of the Republicans, and certainly not the American public, because these deliberations occurred behind closed doors. So another promise made, another promise broken. The last thing I'll mention, and this one I give them a little bit of credit for, because with all the tax increases and all the Medicare cuts, they can actually argue that they do reduce the deficit. But remember that that's in the first 10 years. CBO said in the second 10 years there's too much uncertainty, too much ambiguity to determine whether or not they actually do reduce the deficit. And if you take out the fact that they didn't put anything in there to address the physician fee fix, and that they included revenues from some of these programs like the Ponzi scheme and the Class Act, which has been described as a Ponzi scheme not just by our side but by the Democrats, that their whole argument that this thing's deficit neutral would be completely out of balance too. And even David Broder, the sort of the dean of the Washington Press Corps, has said that this bill is a budget buster. So I think you could argue that the whole idea that it's not going to add a dime to the deficit also is a promise made, and if not broken today, will certainly be broken when we get into the out years and we can actually look at the impacts of this in the long term. With that,